Well, let me introduce my guests who are here with me this morning, as I mentioned, from San Juan Regional Medical Center, the Cancer Center, and the Radiology Department. Troy Fuhrman is here. He is the director of the Radiology Department and the Cancer Center. Troy, good morning.
Good morning, Scott.
Welcome back to KSJE. It's been a little bit of time since you were here last.
It was. I think the last time we were here, we were talking about our new mammography program. So,
right.
Glad to talk about something new again.
There you are, and we didn't have all this around, right? So now you get to be on camera and everything else.
Smells like a new car in here.
That's right, the new studio smell, we call it.
That's it.
So
okay,
that's what we have. But great to have you back. Thank you very much. Also joining us here in the studio is Deb Albin. She's a registered nurse and the Cancer Navigator at San Juan Regional Medical Center. Good morning to you.
Good morning, Scott.
Thank you for coming in.
Thank you for having us.
You bet. Great to have you here as well. Well, Troy, let me start with you a little bit about some equipment, because you were talking about some of the programs and things, but the Cancer Center is testing out, I think, some brand new equipment that's been recently installed, correct?
Yes, so we're in the process. We're coming to the final stages of putting in a new linear accelerator. This is basically a new cancer treatment system, and we basically shut the Cancer Center down the very first week of June. And so we've not seen any patients up to that point. So we are very ready to get back into action and start helping people again.
Right. And you had to shut down just because of the changing out of the equipment, right, and everything?
Construction, electrical lines. I have a whole new respect for our contract company that came in and did the work. It has been very exciting. This is like a $5 million project. And along with purchasing this, along with a new CAT scan machine that is not like a normal CAT scan that we normally see at the hospital. It may look like it, but it does so much more. We do three-dimensional imaging with it, and we use lasers to cross-hatch the patient, so make sure we are dead on when we're treating. And so those images get sent to the new radiation therapy machine, and that's what helps it focus on that one small tumor in 3 dimensions. So what we're increasing now is we have stereotactic body radiation therapy. It's basically like a cyber knife. So we have not had that kind of technology here before. So we are going to be able to treat the smallest of tumors that are like the tip of my finger that could live on a nerve. And it's an amazing treatment.
Right. Sounds very precise, as you describe it.
Yes.
And more precise than you've been able to do before, and your doctors have been able to do before. Is that
correct? And, we're also able to do some of the new technology that has respiratory gating. So if you have a tumor maybe in your lung or next to your heart, every time you breathe, it moves that little bit. So the system now will image that on the CAT scan. That transfers over and monitors your breathing with those lasers and is able to move the radiation therapy with your breathing technique. So it's state-of-the-art technology. We are one of the first ones to get it west of the Rockies. I just want to thank, Santa Fe, Albuquerque, Durango, especially taking care of these patients that we've not been able to see, because unfortunately, these people may have been getting chemo here in Farmington, but they have to drive up to the other location to get the radiation therapy that they need, and it's difficult on those families, and we're ready to get back and to start helping people again.
Right. And this is something I think obviously you've been planning for, right? So these patients had some advance notice of what was going to be happening and how to maybe make these changes to their treatments and things like that with these other partners that you mentioned.
Yes. So this has been planned for almost 2 years. Once we notified, we had a pushback and we had to wait another 4 or 5 months. Once you start treatment on a patient, you cannot stop and send them somewhere else. So once you start, we finished patients. We had a time, so we wouldn't take new patients on the last month. So once that was done, we cut it off.
Right. But now it sounds like you're getting ready to restart the treatments for your patients with this new and improved machinery technology.
Yeah. So unfortunately, we lost our last radiation oncologist during this time. And so we are bringing in a locums physician, and we are actively recruiting. We have a new physician waiting that contract to be signed, that he will be our new radiation oncologist starting in November. We are hoping to be open by the first week of October, getting people scheduled to come in with our new physician to start therapy treatments for people that need it.
Right, right. Now, all this sounds great and very advanced and cutting edge, and I imagine it doesn't come cheap.
Does not. As I stated that, the whole package with the new CAT scan, everything, $5 million with
Okay.
all the construction. So during that time, you have revenue that the hospital needs, and that's, something that we were willing to say we have to stop. Even to bring in a mobile unit, you have to build a whole nother system. They actually have radiation therapy in semi-trailers,
Okay.
but you have to build the protection of the concrete around it. It's about $1.5 million for 3 months.
Even for temporary services. I gotcha. Interesting. Okay. And you mentioned that this is a unique machine, the first of its kind in the west of the Rockies, I think,
Yes.
or is what you said. And that was just because of you had gotten your order in, I guess, before all heck broke loose and computer chips became a endangered species, I guess.
Yeah, that thing called COVID came.
That too.
Since it shut down a lot of areas where chips for processors are made, China being one of those big places, we were lucky enough to get it in. As I stated, we've been working on this 2 years. A lot of people, by the time they did put their order in, they're behind us, and they are really held up. So we're talking 3-4 months before they even are offered a system. So
Right. And so being able to offer this, I guess, obviously, as you mentioned, patients have a lot more maybe options for treatment, or doctors can, and again, find these really small tumors and get rid of them before they have a chance to grow or spread or things like that. I mean, that's all part of this, I would assume.
Yes, so some of the treatments that we'd see, like a lung cancer, breast, anything like that, you can go up to, what did we say, 8 to 10 weeks, depending on what the
Right.
oncologist wants. This system will cut it down to 2 weeks. So that is a huge
the treatments.
turnaround. The treatments.
Wow.
Total
Right.
treatments. And that is just total night and day for a patient.
Sure.
And so we're really working with, we're going to be working with the general surgeons, prostate treatment. Very big changes with that, with some of these micro treatment areas. Parkinson's, MS, things that you didn't think about. We will be working with the neurosurgery teams of San Juan Regional. We have 3 great neurosurgeons that work there, and our oncologists will be meeting with them to go over some of the options that saves a patient from actually going under the knife. You're treated with radiation and can walk home.
Right. Wow. Amazing. And I would think that having this brand new piece of equipment might help with recruitment efforts once the word gets out and you're able to kind of show it off a little bit and say, here's what we have for this if you want to come work for us.
Mm-hmm. And recruiting physicians, when they see some of the equipment we have at San Juan Regional, we've brought in, we, like many other hospitals, unfortunately have to deal with traveler staff, nursing, radiation, everything. And when they come here from big cities, many people are shocked to see, wow, your hospital, you're kind of in a very interesting location, beautiful country, but you're so small. How do you have this nice stuff here?
Not so many hospitals of our size can afford it, I guess, is what they're saying.
Exactly.
Right?
And being a not-for-profit, we're kind of that unicorn right now. And it's nice to see people come in and see that. Physicians that when we tour them are amazed that we have such a great MRI machine or a PET scanner. A lot of hospitals our size don't have those luxuries. And so our community has been so helpful with our board of directors being, local people in town, that they want to keep that excellence.
Right. Well, and I think we've seen too that the hospital and medical care has been targeted as an economic development industry, if you will, and it certainly draws in people from outside of the community for medical care, as you described, some of this new technology and things being able to, and so it's an economic driver for the community.
Yes, when you
with the work that you do.
Yes, and when you recruit people, they normally come with a partner, and when they come, those partners need work also. And so they bring new things such as restaurants or new businesses. So we're starting to see a drop off of some of the travelers and bringing some people back. What's interesting is I've interviewed 2 people in the last couple of days. One's from Washington State, one from Houston area, and both them and their spouses grew up in these areas, Durango, and they want to come back home.
Nice.
Again. And so it's nice to see that we're starting to get some of those people coming back home again and wanting to raise their families here.
Right. Well, and that helps maybe make a better fit too. If they're already familiar with the area, they kind of know what to expect, and maybe they'll stick around for a little bit longer time than the average employee. Who knows?
Yes. We're hoping we're going to have a turnaround in San Juan County again.
Yeah, there you go. Deb Albin, let me bring you into the conversation. You've been waiting patiently, I know, to get a word in edgewise between Troy and I, probably, right? So, but you're probably excited to have this the Cancer Center up and running again,
Very excited.
to be able to continue your work with the patients. And for folks maybe who aren't familiar with the work that you do or the work of a cancer navigator, can you kind of explain your job to us a little bit?
Scott, what I do is I get the privilege of walking them through these troubled waters of cancer. We have an absolutely beautiful hospitality house called the Conley House. This is like a 5-star motel for traveling patients. They can go home on the weekend if they desire, but it's a beautiful facility that we offer.
They get to stay there during treatment if they...
And it's free of charge.
Right.
It's free of charge. So that is a wonderful thing that we get to offer them as well. I do the pre-op for the breast cancer prior to lumpectomy, mastectomy. We do the support groups there at the Cancer Treatment Center. We do all the Kathy Lincoln and Riley, which is a financial assistance, because a lot of times people have insurance, but they're a little bit uninsured because cancer is not cheap.
Right.
So we get to assist in that.
And these are funds that are available in the community. Pardon me for interrupting,
Yes.
but just so everyone knows, these are funds that have been raised through the Medical Foundation, the San Juan
Yes, it
Medical
is.
Foundation,
Yes, it is.
that are made available to local men and women
Yes, sir.
who maybe their insurance falls a bit short, or some other expenses or things like that they can apply for and maybe get helped out financially in that regard.
Exactly. And if they're traveling, even from another state and getting treatment here, they qualify for help.
Gotcha.
So that's another benefit.
Right. So you make sure they're aware of all these different
Yes, sir.
things,
Every
right?
patient that comes through our office for treatment comes through my office. So it's a privilege to serve.
Right. And I would think, obviously when someone gets that diagnosis, there's a whole lot of things that goes through their mind. So it's probably nice to have a person to contact and to say, what do I do? Or what's the next steps?
Sure.
Or how do I figure out all these things that are just coming at me with this diagnosis?
True. I have a little bit of an inside view. I'm a stage 4, 2-month-to-live survivor. So I get it.
Right.
And I think there's a connection because of that.
I'm sure.
So
I'm sure. And you can relate maybe better than someone else, maybe who hasn't been through what you've been through.
I don't think you have to go through cancer to have a heartbeat for this, but I have a view and a heartbeat that I wouldn't have had without it.
Gotcha.
So,
and with this new technology and this equipment that Troy is describing, I mean, that probably opens up a lot more treatment options for patients, maybe that they hadn't heard about, as he was mentioning, the decrease in time for treatments and things. That's got to be really remarkable for patients.
absolutely, because the fatigue that comes from chemo and the fatigue that comes from radiation is astronomical. So to cut that down, like he was saying, from 8 to 10 weeks to 2, how exciting is that?
Right. Very much, I would think. And I know a lot of folks, those side effects are just, can be really troubling and really hard to
Absolutely.
kind of just keep going through to get to that
Absolutely.
final treatment. And so if you can shorten that, that's a big game changer,
You bet.
I would think. So
It's a benefit. It's been, like Troy was saying, nobody wants to stop. You want to serve your community, but this in the long run is going to be so worth it because we can do so much more and cut it down. It's so beneficial.
Right. Very true. And so as Troy was mentioning, with the Cancer Center reopening and booking of patients and things like that, that means busier time for you, but you still are working with some of the patients that have been through before, correct?
Oh, absolutely. If they have any questions, concerns, they can stop at my office. Like I said, we at the end of their treatment, we come up with their closure, their now the word just leaves me, their long-term goals and what they can expect, and we put all that together for them.
Gotcha.
Their end of their radiation treatment, their survivorship care plan
Okay.
is what they're given.
Got you. But if they're completed with that doesn't mean that they go away. That you you
there's
keep in
follow-ups.
contact with them, right?
Yes. Yes, we do.
And you can help them, or if they have a question or something else comes up, you're available.
Yes, sir, I am.
And that's really important. And so,
I think so.
right, very, very good. Troy Fuhrman, let me come back to you a little bit about, again, some of the other things that you're able to do now with this equipment, and it just seems like with technology, like everything, it's moving by leaps and bounds, and you're able to, technology can do things that what we weren't able to do just a few years ago. You mentioned some of this thing, the very precise treatments and things along that line. I mean, that's got to be pretty much a game changer for a lot of these patients and specific cases, right?
Yes. So I've been at excuse me, at San Juan Regional for over 30 years, watching it change from when the cancer center used to be in the our HR building now.
Right.
And when that moved, and that's been 10, 11 years ago, I believe, is when the new building was. And that's how long we've utilized that machine. And it's been a workhorse, and it's saved a lot of lives over the years. And so this is the time to change. And when we changed, we wanted to go with state-of-the-art, top of the line, and the research we did with this, making sure we had the right equipment. This level of saying that I could treat a tumor in the brain that's the size of a pea or smaller is amazing, that you can treat that from multiple different angles at the same time, three-dimensionally. So stereotactic radiosurgery is basically what it is, and the treatment is going to be so much easier on a patient from the sickness portion of it as well, but the modulation of the radiation can be just as high treatment. One treatment would something like a tumor like that in the nerve that you would treat. If you can do that in one treatment and not have to come back again, amazing.
Right. And I would think, is it true that then with this technology and this machinery that there are maybe some cases that you can treat where maybe beforehand you weren't able to treat, or that wasn't an option, or it was maybe more of a surgical option?
Yes, and some of those were either surgical, or we would have to send them possibly like down to Mayo in Scottsdale or in Rochester, where they actually have a gamma knife, a whole different platform system. But technology's come such a long way that now we're going to have this in San Juan County to be able to do these treatments.
Wow, really amazing, and which is why it's been invested and been able to do that. And the money, I would assume, came from various sources. I would assume the medical foundation maybe helped, or the auxiliary helped with some of this, or some things. I know they do some things at the hospital.
There's,
equipment.
with bonds, along with, our state, our legislatures have helped. The leadership at San Juan Regional has helped a lot, trying to bring financial help with a lot of our capital projects. We could try to do cookie sales and things like that. It'd probably take a little longer.
That's a lot of cookies.
That's a lot of cookies.
Yes, sir.
But yeah, it's just the whole team effort. Right now we have the new Da Vinci robotic system that we just purchased for San Juan Regional. That's they're actually training on at this moment. That's going to assist also with prostate. So, working with those kind of things along with ours, it's a big team effort,
right?
And to get the patients to where they need to be healthy again.
Right. And that Da Vinci robot that you mentioned, I've heard a few things about it. It's a surgical robot, basically, that's controlled by a surgeon in the room with the patient and the robot. But again, precision, I guess, is what we're talking about. Exactly. And it can be very precise and very measured in what it is doing on a patient. And that's kind of one of the benefits, I guess.
Yes.
And there's more, I'm sure.
So everything has gotten more precise, as we've spoken about. So everything you do in medicine nowadays, going from what it used to be 20 years ago to now we're down to micromillimeters, and making sure we're treating that specific, and you're not taking out healthy tissue. You're treating just that bad part.
Sure. And I guess that means faster recovery, hopefully for patients in addition to that as well. Let me ask you a bit about the radiology department, which you also oversee. And it just seems like, anytime we go in for something, depending, I guess, what it is, but it seems like the first thing we do is get a scan to see what's going on, or to take a look, or, that seems to be a bigger part of the diagnosis maybe these days, maybe than it was. Is that what you see as well with your staff? And
so when you go to your primary provider, they, you have a cough, let's do a chest x-ray. Oh, we found something, let's now do a CAT scan. Or I hurt my back, so let's start with some x-rays and then an MRI, and we find something. We're part of that diagnostic team once your provider has seen you, and once they make a diagnosis off of our images, they make a decision, should this be surgical? Should this be chemo? Should this be radiation therapy? Or maybe you just need a pain injection and do some stretches.
Right.
Right. But yes, that's the big part of what radiology is being part of the diagnostic team.
Sure. And I imagine in some cases, if you come in for one thing and maybe there's a scan and maybe somebody sees something that doesn't look quite right on that scan that's unrelated to why you came in, but you discover maybe something else that doesn't quite look up to snuff.
Yeah, so a mammogram, something so simple that women go in for on an annual basis, and we find something, your next step may be a breast ultrasound, which is going to look at the tissue in a different way. Then the next step may be we want to stage where this tumor is, so now it's an MRI of the breast, very special type of procedure. And then if that follows and maybe it's in the lymph nodes, the physician, now that you're probably sent to an oncologist to treat, will say, hey, now I need a PET scan. So you've had 4 different procedures before they've even started your treatment.
Right.
And they want to stage all these things. And each one of those show tissues, muscle, tumors in a different light. They all look very different, but very helpful in the diagnostic portion to treat.
Right. And I guess that would help maybe the radiologist or the physician to say this needs to be treated or this doesn't need to be treated, but we need to take a look or keep an eye on it or those types of diagnoses?
Yeah, so they may look at, if your surgeon is going to do a lumpectomy or a mastectomy, they want to make sure, how far does this go into the lymph nodes? Very important. You don't want that because if you leave one lymph node, 6 months from now, it could have progressed and now it's in the bone.
Right.
So we do a lot of follow-up scans after the fact to make sure that those things don't happen, and
sure,
that helps the doctors take care of you.
Right. And it's giving them really important information every step
Yes.
of the way to be able to make their decisions.
Yes,
and
that's
that's
correct.
what's important about too. Deb Albin, let me come back to you a little bit about, again, the work with all these things as these women are getting these scans, and men, and determining what the next treatment's going to be. You're there with them, right? If it's
Yes,
cancer, and you can offer some assistance, and if they want options or things like that, is that something that you can offer as well?
Yes, it is. Yes, we go answer their questions to the best of our ability. And I tell them, even though I've been in this since '05 in oncology, I don't know it all, but I will help you get the answers. Because some of the questions they come up with, I haven't heard. So we get to the bottom of it and get the answers. And I think it's a comfort to know that they have someone they can go to and help guide them.
Right. Which is what you do.
Exactly.
Exactly. You mentioned earlier support groups, and
Yes.
they are, I think, coming back more frequently maybe than they were during the pandemic. Are you
Yes,
seeing
sir.
more of that?
Oh,
Is that
yes. We do a men's once a month. We do a women's on the first Saturday of the month and the second Wednesday of the month. Food is always a part of all of it.
so? They're in
we get
person.
them there.
We're not zooming anymore.
No, we're not.
Okay, we're able
No.
to meet in person, and so that's got to be important, I would think, too, for patients that are going through to meet other people, maybe going through similar or it's a different stage of their treatment or what have you.
Exactly, because you don't feel alone, even though we've all heard cancer and our lives have been touched in one way or another. When you see someone with skin on that's been there, done it, and doing the same battle as you don't feel alone. There's a lot of good that comes out of that group. Information, oh, I didn't realize, oh, I can do this. It's very, very beneficial.
Right, and I'm glad to see that they're back and
Me too.
coming back, and hopefully
too.
the numbers are coming up as well.
Yes, they are.
So that's important.
Yes, it
Very
is.
good. I think all of us would be remiss if we did not mention the Cancer Walkathon event that is happening this Saturday
Right.
to benefit the Connolly Hospitality House, which you mentioned,
Yes.
and the Salmon Medical Foundation. So we definitely want to make sure folks are aware of that because that does a lot of good in the
Oh,
community.
it does.
And it was great that they've had the razor that was won.
Oh,
That's
by
right. That
Mr.
was just
Whipple, I believe, was his name.
Zero
And so
Vista.
congratulations to him.
Right.
Yes.
That was
That raised a lot of good funds also.
another fundraiser. You bet. And that was a pretty nice looking prize from what I recall
The
seeing.
trailer and the razor was amazing. Yes.
Yeah, usually make it into a pretty nice prize package there
Yes.
for that. So congratulations to him. But thank you both for coming in to talk about the work that you do in the community and with patients that come through the Cancer Center and the Radiology Department. Appreciate you both being here.
Thank you for
Scott.
having us.
You bet. Great to have you both here.